Welcome back, everybody. During summer, we want to wear shorts, skirts, and dresses, but many women are too embarrassed to do so because of spider veins.
Yeah, they can be an isolated problem or a symptom of something else. The good news is there is treatment. And joining us now is Dr. Deborah Manjoney with the Wisconsin Vein Center MediSpa. Great to see you.
Thank you. Good morning.
And I'd like to start out with something that a lot of people know, but I think it's always good to remind people about your medical background.
Sure.
You're a
I'm a
cardiothoracic
surgeon. Right. So I've been dealing with vessels for more years than I want to say.
Yeah, so because of that, you know a lot about veins.
I do.
And how they relate to the heart and how everything.
Plus, I've been working just with veins for the last 12 years. And so we've had our center for 13 years, but I gave up cardiac surgery after another year. And so we've just really been trying to specialize in treating vein problems. So whether it's varicose veins or spider veins, that's kind of our specialty.
Do you know the game Operation?
I do. I certainly played it as a child.
That was your inspiration, right?
One of the inspirations, yes.
So I bet you a lot of people come in with the idea that they are just going to fix something cosmetic, and then they find out in the process, oh boy, this is indicative of something.
That's exactly right. They come in with some spider veins that they think, oh, I've got to get my legs looking better. And then you start talking to them and they tell you about how tired their legs are, how achy they are, how they get throbbing in those spider veins, or how they get cramps in their legs at night. And I say, you know, we should do an ultrasound because you probably have an underlying problem causing the spider veins. That is certainly not the case with everybody. But when we do find that and we do an ultrasound, often we'll find that there's a trunk vein that's not working properly, and we have the solutions to treat those as well.
Because treating it can make your legs look a lot better.
Treating the spider veins can make your legs look better. Taking care of varicose veins can make your legs look and feel tremendously better.
It's about getting to the root of the problem,
That's
not
exactly
just solving what you see on the surface.
That's right. And we do see a lot of people who have gone to other places and have had some spider vein treatment, either with some injection sclerotherapy, where we inject a little irritant into the vein to get it to clot off, or they've had some localized intense pulse light or laser treatment, and it doesn't work. Well, it doesn't work because they didn't see what else was going on. And so really going to an area, a center that specializes in venous problems is going to give you the options of learning about what's causing this and seeing if there's something more that needs to be done.
Unfortunately, 70% of us will get varicose veins. Spider veins. I'm sorry, spider veins at some point during our lifetime. Men get them too.
Yes.
But one of the treatments that you mentioned is sclerotherapy. And that can be, that's obviously something you do in office, but can be very effective.
Very effective. Now here's a little video of laser treatment that we also do, and we're the only ones in town who have, or in the state, who have this little laser. It's a pinpoint laser where we're just tracing out the spider veins, and that helps as the first step in performing spider vein treatment. Then we will inject into the veins that are leading into these smaller veins or into these veins themselves, and we'll use a detergent that's FDA approved. And what that does is it helps the vein go into spasm and close off. It irritates the inner lining of the vein so that it sticks. And this is the sclerotherapy part, where we're looking at the vein under the skin that you might not see without a light, and we're injecting and we're getting those veins to close off. And so it's a process because there are so many veins that network underneath. It's almost like having fishnet stocking underneath your skin. So you have to look and see where all the connections are in order to treat them properly. And we use a surface laser and we use injection sclerotherapy, and we get really good results. It may take 2 or 3 treatments. You will feel the pinpricks. Actually, the laser hurts slightly more than the actual injection because we're using such tiny needles. The laser feels like a little hot pin on the surface, and we use a cooling jet of air as we're doing it. And then when you're injecting into the spider veins or into the bigger veins, going into the spider veins for the sclerotherapy portion, I've had it done, and it feels like the needle's on your skin, and you're kind of waiting now for that next ow. And it doesn't happen. It's such a tiny needle, you just know it's there. You feel that tiny little bit of sharpness, and that's all.
So again, this is a process, as you mentioned. What kind of downtime can you expect as you're going through that process?
There's no downtime. You can go back to normal activities immediately. You do have to wear a compression stocking for about 5 days. We just think it gives you a better result if you're able to do that. Most of the time, even during the summer in air-conditioned offices, it's not a problem. Results are great.
That's amazing.
It really is nice. And as far as the look of it, it's going to look angrier and a little irritated for 2 to 3 weeks minimum, and then it starts getting, the vessels get absorbed by your body. So it takes about 4 to 5 weeks for them to totally really start to fade and go away.
Is it covered by insurance ever?
Spider vein treatment is not covered by insurance unless somebody's had bleeding from a spider vein spontaneously.
Varicose veins, though, very often
Varicose veins are almost always covered by insurance,
Okay.
and it's a great time of year to come in for evaluation for varicose veins because we're getting to the time of year where people have their deductibles paid off or almost paid off,
Yeah.
and often it takes a while for insurance to go ahead and authorize treatment.
Explain the special that you have going on right
So
now.
the special we have right now is for spider vein treatment. So somebody who has a cosmetic issue with spider veins on their legs, they can actually get 2 treatments, buy one, get one at half off. And they have to have the first one during August, but then the other one can be 6 weeks later or 8 weeks later or whatever they'd like.
Wonderful. So it's a special this month. First treatment needs to be in August. The second one does not have to be. The second one is half off. You can call and find out more about spider vein treatment as well as a lot of the other services they offer at the Wisconsin Vein Center and MediSpa. They're located on Georgetown Drive in Pewaukee. The phone number 262-746-9088. Consultations are free, and wimedispa.com is the website to visit for more information. Thank you.
Thank you very much.
Appreciate it.